Hello, it's Dr. Aria here with another session of Health Talk. How have you been doing? Well, today we are talking about the diabetic foot ulcer. Now, I am doing this topic because a few people have asked me to talk about it. We've done a wonderful video on diabetes, and we learned about the serious complications that can happen from somebody having diabetes. Okay. Now, having a diabetic foot is usually one of the common reasons why someone with diabetes will end up in hospital admission. Having a diabetic foot ulcer greatly increases someone's chances of actually death, about more than 40% chances of dying because of having a diabetic foot ulcer. So it is important. Also, this same condition is one of the major reasons why a diabetic person might have an amputation where they lose a limb. Your risk actually of dying or your risk of having an amputation increases by 10 to 30%. Wow, this is big, okay? So hear that again, your risk or somebody's risk or a person with diabetes, their risk of getting an amputation increases, okay, by 10 to 30%. That risk is higher. So this is something that you cannot take with. And also someone's chances of death after an amputation greatly increases. Within the 1 year, it's about 13 to 40%, okay? So after someone has gone through something traumatic as having an amputation because of their diabetes, their risk of mortality, i.e. their risk of dying, is actually also greater, okay? And it works out to be, from studies, about 13 to 40% in the first 1 year. It's about 35 to 65% in the third year of that amputation, their risk of dying. And then it goes higher even as the years progresses. So this is really serious stuff, okay? Also, nearly half of all, that's more than 50% of all ulcers that do not heal actually can cause death within the first 5 years. Okay, so if someone has diabetic foot ulcer, we are saying that if you look at the population of those people, nearly half, that's more than 50% of them, will die within 5 years. So you can see having diabetes and having the complication of a diabetic foot is serious stuff. It comes with greater comorbidities, i.e. a lot of health problems, and also poorer outcomes that can result in death, okay? So that is why it is an important topic to really talk about, all right? Now, moving on. What is an ulcer? An ulcer is an open wound. It's a break in the skin, okay, that causes a sore or a wound, all right? Now, why does this happen in someone with diabetes? It's because of the loss of feeling in the foot, okay, due to nerve damage. For those of you that watched the video on diabetes, we talk about the complications of diabetes, how it can damage your nerve. Your nerves are important for us to feel pain, to feel sensation, okay? And when this is lost through damage, then we lose that ability to be able to feel pain. And people with diabetes, when they get nerve damage, they can't feel pain. And that means that when they step on a nail or they step on something that causes injury to the skin, they can not actually feel it. Often, therefore, they won't seek help on time. There's a risk of infection. There's a risk of an ulcer, okay? Another reason why foot ulcers happen in a diabetic patient is poor perfusion or poor blood flow, yeah? So diabetes is a condition that actually affects circulation, affects your blood flow. And when we injure ourselves, our body is able to heal itself because of adequate blood flow to that place. Remember, blood supply carries the right nutrients, it carries the right immune cells at the time that can be able to respond well to that injury and heal itself. But often for people that have diabetes, they have damage to the blood vessels and therefore circulation is poor. So poor blood flow can result in diabetic foot ulcer. Another reason is poor wound healing. For the same reason, if you have poor blood flow, your chances of healing quicker are reduced. And therefore, these patients can get recurrent infections. And every time you have an infection, there's a accumulation of fluid to that tissue. There's a lot of tissue damage while the body is trying to heal itself. There's a lot of cells that, often actually in a normal situation, they're actually healing properly. But in this case, where there's things going wrong, the influence and the efforts they are making actually is causing more harm. And therefore, these people are always having inflammation and swelling and fluid in that area that is causing more damage actually to the surrounding tissues and the wound not healing properly. Okay. Also, direct injury to the skin can cause a risk of ulcer or a wound to happen. Okay, so if someone steps on a nail, for example, or they got hit by something and it broke the skin, that is another risk factor. So all these factors can actually increase the risk of diabetes or diabetic ulcer, or a person with diabetes getting an ulcer. And actually, when you keep having infection, it can sometimes also spread to the bones, because often, remember, they can have superficial wound, which may be just on the skin. But over time, infection, if not treated properly, can track through the skin, go through the muscles, hit the bone, and that is a serious problem. You end up with something like osteomyelitis, which is infection or inflammation of the bone, which is often hard to treat. And that's another reason why most people might end up with an amputation if it is not well treated. Okay. So moving on. Now, just quickly before we do that, just a little bit about the signs of infection. Okay. So I would say that if you have diabetes and you notice any signs, for example, pain on that area of the skin, or redness to the skin, or swelling to the skin, or feels hot to touch, or you notice anything oozing out like pus or fluid, these are all signs of infection. And this is not the time for you to be sitting on it and thinking, oh, will get better. You need to seek help. Make sure that it's treated, and it's treated adequately on time, either with antibiotics. If the skin is broken, that you get the right treatment in terms of wound care with the right dressings, so that you can heal quicker. Okay, because the longer you leave it, the risk of things getting worse is more likely. All right. So don't make any assumptions. Okay, if you notice something, on your skin, whether a blister or colors, anything that you're not sure, particularly for a diabetic person, on your foot, you can't take it for granted. Okay, you need to see a specialist, you need to see your doctor, or see someone to examine it for you. I would say that in terms of when it comes to the risk, what increases someone's risk of likely ending up with an amputation when it comes to a diabetic foot ulcer is that when you have any wound or any ulcer that is not healing properly within 4 weeks, that is a red flag for you. That is a warning sign. Okay, it should be a cause for concern. So if you have a wound and within 4 weeks the wound is still looking very open, it's still looking bigger and the same size, or it's even getting bigger, the wound is not healing at all, please, this is a red sign for you. Yeah. Now, when you have a wound, okay, for a diabetic person, if you have a wound within that 4 weeks, if you're not getting 50% reduction in that wound size, so usually if you started off like a round or whatever size that was, and within that 4 weeks you've not seen at least 50% or more reduction of size or of that wound, that means that you need to be worried and you need to get it seen. And this is actually not because you're just sitting down and waiting for the wound to just shrink, but this is you doing the right things, having the appropriate and the standard wound care, okay, in terms of cleaning, in terms of dressing it, and everything. If it's infected, is being treated, and you're not seeing any progress in the wound. And by progress, you're looking at the reduction of that wound, okay, by 50% or more, then you need to get seen, and they should actually be stepping up in terms of management of that ulcer, of that wound. Okay, so if let's say 4 weeks, you've seen 50 or more percent in terms of how well the wound is getting, that's a good predictor, okay, that the wound is going to heal. But wounds that are not healing at that time, you need to be getting a check ASAP. All right. So moving on again. So when it comes to caring for the foot or the diabetic foot, so we're dealing with diabetic foot ulcers, okay? It is important that we achieve good glycemic control. So we're talking about achieving good diabetic control, getting your sugars on target, getting your sugars back to normal as much as possible, okay? Because for some diabetic people, we might not be able to get your sugars back to range, normal range, but at least we can try our best to get there, all right? So having good control is important, and that's why it is important to be compliant with your treatment. When a doctor has prescribed your medicines for your diabetes, it is important that you are taking them. Make sure you are maintaining healthier lifestyle changes. So if you need to make changes to your diet, and we talked a lot about that on this platform, so there are videos that you can watch about diet and about diabetes so that you can gain more information and know what to do. Also speak to your diabetic nurse, speak to your doctor to get more advice, on what to eat, what you should be cutting out, what you shouldn't be doing. I normally say that if you are confused at all, when it comes to diabetes, sugar plays an important part. So anything, to start off with, in your own way, anything that looks like sugar, that smells like sugar, we all know it. We know the chocolate, we know the biscuits, we know the donuts, we know the cakes, all those things. We know. Someone doesn't have to tell us it's sweet already. We know it. If you cut those things out, even before you think twice about it, cut those things out. Then it comes down to your other meals, your proper meals that you eat, your carbohydrate. Carbohydrate, remember what we said, is the main source of sugar for the body, all right? So you need to aim for a low carbohydrate diet. But I'm going to leave you to watch the videos that we've done on this platform about all those things. And if you have more questions, then speak to the appropriate person, either your nurse, either your doctor, to get more details, okay? Like we said, the pathology or the things that are going wrong, part of it is poor circulation, all right? So you might need to have some vascular intervention. So that's why often you should be seeing a diabetic specialist. For anyone that have a diabetic ulcer, they would tend to be seen by a vascular team or the appropriate people in charge of that. And you should be seeing someone, and they might prescribe certain medications that will help to improve your circulation, okay? Also, one of the treatment that you might have, that you might find out that they might have to do some debridement, i.e. removal of some of the dead tissues around the ulcer, okay? This is all done to improve the circulation around the circulation and then improve the healing of that ulcer. Also, make sure you maintain good nutrition, okay? And that comes down to what you're eating, okay? Also, treat any infections. Like I said, I've given you some of the signs of infection. If you notice any of those things, please do respond to that quickly. Don't be very inactive when it comes to your diabetes, when it comes to any problems that come with diabetes. You need to be very proactive, okay, and take action quicker, okay? So let any infections be treated with the right antibiotics and the right wound care, all right? Offloading, anytime that there's a concern about ulcer, about infection, make sure you take pressure off your foot. Now, sometimes they might put you in a cast, or they might put in a bandage, whatever it is, or whatever is available wherever you live. When you see the doctor, they might try and advise you to take pressure off the foot so that it will allow the healing process as well. Make sure you have regular routine follow-ups and regular monitoring of that ulcer. Have a proper wound care plan in. So when you go and see a nurse, ask them questions. What is the plan? When am I supposed to come back? Am I supposed to come back? When do I have to change my dressing? When do I have to be on this antibiotic? Do I need to be on antibiotics? You need to be asking the right questions, okay? And then if you're not sure, just say, what do I need to do? And be proactive in that, okay? Get your feet checked regularly. This is really important, to get your foot checked regularly, okay? Now, on the whole, okay, and this is the last bit of this, okay? Prevention is better than cure, like most things, okay? Because most of the times when people go and see a doctor or go and see a nurse, they're already going with a problem, okay? Something has gone wrong. They've already acquired the condition. They've got a problem, and they're going to see the doctor either because they've had the symptoms or they're not feeling well, okay? So you've already done it. The problem has already happened. But actually, it would have been fantastic if you could have prevented that happening in the first place, okay? So when it comes to the diabetic foot ulcer, okay, or the diabetic foot, you need to make sure you wear the appropriate footwear, yeah? Avoid wearing all those pointy shoes, okay, especially the ladies, that will cause friction and cause problems, rubbing of your toe or of your toes, against the foot or against your footwear or your shoes, whatever you're wearing. These are more likely to cause thickening of the skin areas, more likely to cause things like calluses, more likely to cause blisters and cause you problems. And because when those things break down, because a hard skin or a dry skin is more likely to crack, okay, than a soft skin. And that is more likely to going to result in problems, particularly if you're diabetic. So make sure you wear the right footwear. Don't go barefoot at no time. Even if you're in your house and your carpet is the nicest one, wear slippers that you can actually wear on your carpet. You should never go barefoot, particularly if you've lost sensation in your feet. You're not going to feel it if you step on a pin or something like that. And that is why it is important as a diabetic person, never go barefoot, okay? Examine your foot daily, yeah? This is so that you are connecting your brain to your foot. Remember what we said? For a diabetic person, most of the time they lose sensation, okay? So if you don't have feeling, you're not going to feel pain like most other people, all right? So your brain does not, in terms of feeling, has gone. So what you need to try and connect your brain to your foot by allowing your brain to be looking at it, okay? And when you look at your foot, you'll be able to see whether there's any cuts, there's any cracks, there's any blisters, there's any calluses, there's any discoloration of the skin, anything that should not be there. So you need to be regularly looking at your foot on a daily basis to see if there's any changes so you can respond to it much quicker, okay? Always moisturize your foot regularly. It's so amazing. So many people you see in clinic setting and they take their feet off and you're like, oh, lordy, what is going on here with this foot, okay? Because you can tell they've not even looked at the foot, or when they were just bathing, they just ignored the foot altogether as if it's not part of their body, all right? For a diabetic person, this is a dangerous thing to do. Always moisturize your foot. Make sure your skin is supple. Make sure you cream it, just as you cream other parts of your body. If you do, if you don't, then you should start now, okay? Because if you don't cream your skin, you're more likely gonna get drier, and it's going to be more likely to crack and more likely the risk of an ulcer, okay? So please pay attention to that. Nail trimming. Most people don't trim their nails at all, and you see people with long nails which are actually curved and start digging into the skin, which is not good. And the reason why most of these people don't notice it is because the loss of sensation. So nail trimming is important. If you cannot do it yourself, get someone to help you, get a relative, get a partner to help you to cut your nails so that it doesn't dig into the skin and there's no risk of breakage, okay? Like I said before, regular follow-ups, okay? If you're a low-risk diabetic, for example, because you got good control of your diabetes, often it might be a recommendation to get your foot checked once a year. I mean, in the UK, we have a fantastic system in place where people are often seen by the diabetic nurse in the practice and they get checked. You might be in a country where the healthcare is not that great, and therefore you need to do all you can do, okay, to protect your feet. So get it checked, don't wait for someone to tell you once a year, okay? And also see a nurse, a podiatrist, which is a foot person, or a specialist, if you need to, okay? So I hope today's session has been useful for you and you've gained some valuable information. Please just remember, diabetes is a serious condition with serious problems. Increases your risk of amputations, your risk of death is higher, your risk of infections is higher, and so many other serious problems. Look after your feet, okay? And stay well. So until we see again, it's Dr. Aria here. Bye-bye.